senatorial bloc also could wield its influence over a future infrastructure package that President Joe Biden and Democratic leaders have prioritized. But Democrats are actively searching for GOP partners to work on two more divisive issues: immigration and the minimum wage. Senate Judiciary Chair Dick Durbin of Illinois, our guy in the Senate, said Monday he would begin discussions with Republicans on legislation aimed at protecting the immigrant population known as Dreamers and farm workers. And Biden and some centrist Democrats have said they are open to negotiating with Republicans on the minimum wage. Well, good luck to them. I would love to see Democrats and Republicans working together. I mean, there was a time when that, in fact, happened, fairly regularly, when the goal was to get the job done in some one way or another. Now the goal seems to be to, push things as far in your direction as you can get them to go. And that's not very productive, I don't think. So I don't know. We'll see. Up till now, I mean, on the coronavirus legislation, for example, this bipartisan gangs idea was just way too low. It wasn't going to do enough for anybody. So we'll see if they, can come up with something for immigration other than let's enhance border security, and come up with the minimum wage other than let's leave it as it is for the next 20 years and then maybe raise it $1. I mean, how do you negotiate with that? That's not very helpful. So we'll see. I don't know. I don't know. I think we have a long way to go before we can return to the days of the two parties working together in some way, in some form. Yeah, I don't know. We'll see. Maybe it can be done. Let's hope so. Maybe Biden can do it. That's partly what he ran on. Our next article is entitled "A Profile of Immigrant Women in the Workforce." I'm all about not linking immigrants to jobs all the time and to how much money they can make and or might cost us. But, it's important. That is an important aspect of what immigrants are and what they do. Is they are workers and employers, and they make and spend money. So, it's something we have to talk about. I like to focus more on people. But hey, this is an interesting topic, and women are generally sort of overlooked in a lot of ways. Anyway, so it's time to talk about immigrant women and their contributions. So, for years, immigrant women have made vital contributions to the U.S. economy, and they and their families have become deeply rooted in American society. The average immigrant woman has lived in the United States since 1996, and the average undocumented immigrant woman has lived in the country since 2005. Particularly during this Women's History Month, these essential communities must not go unrecognized. Their contributions and experiences should be centered as policymakers craft solutions for a bold and equitable economic recovery in the months ahead. All women, regardless of immigration status, have borne the brunt of the twin health and economic crises over the past year. While the following data analysis captures pre-pandemic workforce participation, it is important to note that women across the country have experienced disproportionate job loss since the early days of the pandemic. CAP analysis finds that women have lost a net of 5.4 million jobs during the recession, nearly 1 million more jobs lost than among men. Black, Hispanic, and Asian women who have experienced higher unemployment rates than white women throughout the crisis have been the hardest hit. In addition, the latest jobs data indicate severe disparities in economic recovery along gender and racial lines, with women of color, and particularly black women, experiencing the lowest rate of job recovery. Now, more than ever, relief and recovery policies must consider the needs of women, particularly immigrant women and their families. An estimated 12.3 million immigrant women, including 2.5 million undocumented women, are members of the workforce. Together, they comprise 16.3% of all employed women in the United States. The top 5 industries for immigrant women in the workforce are healthcare and social assistance, accommodation and food services, educational services, retail trade, and manufacturing. This workforce includes women such as Teresa, a member of the Service Employees International Union, or SEIU, in Washington State, who works as a hospital registrar. She checks in patients, many of whom have COVID-19, who are coming to see an emergency physician. She recognizes that her own experience as an immigrant from the Philippines has allowed her to connect and better serve patients and their families who also immigrated to the United States. The occupations in which immigrant women are most likely to work closely mirror their top industries: office and administrative support staff, sales and related workers, building and grounds cleaning and maintenance staff, healthcare practitioners, and healthcare support staff. Maria Elena, who now works as a janitor at the university in Florida, was visiting family in the United States when Hurricane Mitch devastated her home country of Nicaragua in 1998. As a temporary protected status, or TPS holder, Maria Elena has been able to live and work in the United States for more than 22 years. The students and faculty on campus rely on her to keep the building safe and sanitized, a role that is especially important in combating the spread of the coronavirus. As a union member of SEIU 32BJ, Maria Elena has advocated for better benefits and leave policies. She continues to share her story in hopes that all can recognize the contribution of TPS holders and the need for a pathway to citizenship. Immigrant women's workforce participation is essential for the livelihood and well-being of their family. 1/3, 33.6%, of immigrant mothers are the primary breadwinners for their families, either as single working mothers or as married women who earn as much or more than their husband. This number jumps to 36.3% for Latina immigrant mothers. More than half of immigrant mothers are primary or co-breadwinners, which includes breadwinning mothers and married mothers bringing home at least 1/4 of their family's earnings. Alongside their neighbors, immigrant women have kept the country safe and running as essential workers during the coronavirus pandemic. They make up 15% of all women working in critical infrastructure industries, such as food and agriculture, healthcare and public health, education, and critical manufacturing. A prior CAP report finds that 3 in 4 undocumented immigrants in the workforce are essential workers. Among those essential workers, 1.6 million are undocumented women. Not only do these individuals and their families face the health risks of working on the front lines of the pandemic, but they also lack access to health care and government relief and continue to face the threat of deportation. In the healthcare industry, immigrant women fill a range of occupations, from hospital support staff to nurses and doctors. All are working to ensure their communities have necessary care and medical resources. Marilyn immigrated from Jamaica more than 30 years ago and has been working as a nurse for 25 years. Throughout the pandemic, she has provided critical care to COVID-19 patients, often without the proper personal protective equipment. Marilyn herself contracted the virus and fortunately recovered with the help of her family. She continues to care for patients while advocating for proper PPE for her colleagues and all frontline workers. An estimated 2.7 million immigrant women work as healthcare providers or in health-related settings, including 740,000 healthcare practitioners, and 277,000 health technologists and technicians. Immigrant women also play a crucial role in maintaining food supply chains and keeping the country fed. An estimated 451,000 immigrant women, including 195,000 undocumented women, are cooks and food preparation workers. An estimated 128,000 immigrant women are agricultural workers, many of whom have continued this work with minimal access to workplace protections and PPE. More than 358,000 immigrant women are preschool through secondary school teachers and special education teachers. As educators, these women are on the front lines of the nation's classrooms, working to keep themselves and their students safe, managing the challenges of virtual teaching, and continuing to shape the minds of future generations. Individuals in the care industry are vital to the overall functioning of society and the economy by providing necessary services to the elderly, disabled people, and children, often enabling other members of a household to remain or re-enter the workforce. In this analysis, members of the care industry are defined as those who are maids and housekeeping cleaners, child care workers, home health aides, and personal care aides. An estimated 1.9 million immigrant women, including 523,000 undocumented women, are part of the care workforce. This includes 504,000 immigrant women working as home health and personal care aides. One of these women is Suk, a 65-year-old Korean-American home care provider in California. During the pandemic, she has cared for 4 clients in their homes while purchasing her own PPE. In recent months, Suk has also directly experienced the increase in xenophobic attacks against the Asian American and Pacific Islander community in her own city of San Jose. Immigrant women such as Teresa, Maria Elena, Marilyn, and Suk provide for their families and contribute to the U.S. economy despite facing significant hurdles. For undocumented women, those obstacles include the constant, daily threat of deportation. As immigrant women continue to make sacrifices to sustain the country during a time of crisis, it is crucial that Congress include a pathway to citizenship for undocumented essential workers and their families in future economic recovery legislation. A robust and equitable recovery must consider the contributions and address the needs of undocumented workers and their families. Immigrant women, regardless of their documentation status, have long been the backbone of their families, their communities, and the country's overall prosperity. As an integral part of U.S. society, they must be celebrated and properly rewarded. Yeah. Can't argue with that. No, indeed. Can't argue with that at all. All right, our next article from Scientific American, no less, is entitled America's Immigration System is a COVID Super Spreader. Whoa. In her teens, Leticia Sierra realized that the future she had envisioned was out of reach. Sierra, who lived in San Diego, fled her native Mexico after suffering multiple episodes of sexual abuse before her kindergarten year. But since Sierra was an undocumented immigrant, she was not eligible for military service, which she'd need to afford nursing school. I was blocked from pursuing my dreams, she said. 2 decades later, Sierra's future was inverted once again. After being pulled over because her then boyfriend was on the phone while driving, and after being searched without a warrant, the police found several tablets of Vicodin in Sierra's purse. A friend had given them to her for back pain. Within hours, Sierra was turned over to Immigration and Customs Enforcement and deported to Tijuana. Desperate to come home and be with my 2-year-old son again, Sierra found her way back to San Diego. There, she, like many undocumented immigrants, lived a quiet life 1 block off Main Street, cleaning homes with her mother and paying her taxes for over a decade. Things changed again on January 16th of last year. That morning, after dropping her son off at the bus stop, Sierra found a dozen ICE officers waiting outside her home, undercover cruisers still running, arrest warrant in hand. After she changed out of her pajamas, family watching, the officers cuffed her on the hood of one of the SUVs. Before she knew it, Sierra had been deposited at ICE's Otay Mesa Detention Center to await her immigration proceedings. There she was, waiting when COVID-19 hit. During the COVID-19 pandemic, detention centers have ranked amongst the most dangerous settings in which to live and work. Since March 2020, ICE facilities have experienced some of the worst outbreaks of the virus. As of February 24th of this year, some 9,569 detainees in total had tested positive for COVID-19. About 10% of those tested have had the virus, a figure which was 17% higher than the general U.S. population. In the time since ICE began testing their detainees, a detainee has died of the virus nearly every month. This amount of suffering did not have to happen. These statistics, as they stand today, were not an inevitability. Rather, since March, at the federal level, ICE has enacted policies inconsistent with Centers for Disease Control and Prevention guidelines, while conducting arrests and raids that run afoul of public health recommendations. And at the facility level, ICE subcontractors have treated detainees with cruelty and callous disregard, while simultaneously evading local health departments' recommendations and offers for help. A first step ICE could have taken was to release detainees, especially those with medical conditions, making them vulnerable to the virus. Indeed, early modeling studies predicted that even amongst the most optimistic assumptions, without widespread release of those under custody, detention centers would be a setup for disaster. However, as of late February, ICE had released only about 3,500 detainees vulnerable to the virus. Meanwhile, tens of thousands remain in government custody. Moreover, despite ICE's policies early in the pandemic claiming to delay enforcement actions other than those deemed mission critical, raids on communities across the U.S. continued throughout the spring and summer. Since September, ICE has all but resumed normal operations in neighborhoods across the U.S., tearing people like Sierra away from their families and throwing them behind bars, including in sanctuary cities where such federal enforcement actions face restrictions on cooperation by local authorities. In lieu of reducing detainee populations, ICE and its subcontracted operators could have constructed physical safeguards and instituted hygienic protocols within facilities to reduce the spread of the virus. Much as inherent challenges to containment of infectious diseases exist in crowded detention centers, as they do in other carceral settings like jails and prisons, and congregant facilities like nursing homes and rehabilitation centers, theoretically, these settings are amongst the most amenable to strict precautionary procedures. Yet clear inaction by ICE and its for-profit subcontractors has allowed the virus to run rampant. Since the outset, physicians have noted inconsistencies in ICE infection management policies that significantly differ from those set forth by the Centers for Disease Control and Prevention. These include policies for intake monitoring, grouped quarantine, and social distancing that failed to meet CDC guidance. The result, placing further stress on a system teetering on the verge of disaster and putting detainees' lives at risk. What actions authorities have taken, instead, have been perilous, punitive, and inhumane. They've withheld protective equipment, transferred detainees needlessly between facilities, ignored detainees' medical needs, and physically and mentally abused detainees with fists, pepper spray, and solitary confinement for seeking medical care. At Otay Mesa, Sierra endured these decisions firsthand. After an officer contracted COVID-19 in March, staff began wearing protective equipment, but detainees didn't receive masks for weeks, and those who ripped sleeves off T-shirts as stand-ins for the real thing were put in solitary for vandalism. In April, in order to receive masks, detainees were required to sign a waiver saying it wasn't our fault if we got sick, Sierra said, while they were verbally accosted with ethnic slurs. Officers denied to translate the form for the majority of detainees that didn't speak English, yet those who translated it for peers were pepper sprayed and put in solitary for disturbing the peace. By May, detainees were getting sick left and right. Sierra herself developed a fever, headache, severe fatigue, and blisters on her mouth and legs, but were denied tests since they did not meet the criteria for COVID-19. Detainees with psychiatric symptoms, including a peer who seemed to be hallucinating, were put in 4-point restraint. Others were vomiting and having diarrhea in bathroom stalls that were shared amongst some 100 bunkmates. The toilets frequently clogged and overflowed, potentially infectious excrement flooding the bathroom floor. On May 6, Carlos Ernesto Escobar Mejia, a detainee living in the dorm next to Sierra, died of COVID-19. They treated us like less than animals, Sierra said. Every night I worried that I wouldn't wake up. As all of this was happening, emails obtained by immigrant defense advocates and the American Friends Service Committee indicate that officials on the other side of the bars were rejecting, ignoring, and avoiding San Diego Public Health Service's recommendations. Internal guidelines addressing PPE were used Internal guidelines addressing PPE use, established on April 1st, did not require masks for staff or detainees in most circumstances, allowing officer discretion based on their scope of duties and as feasible. These guidelines were out of compliance with CDC recommendations. It is unclear whether they were ever updated. On April 29th, SDPHS offers for anything we can do to help mitigate spread were ignored. On May 19th, SDPHS guidance strongly urging facilities to test staff were rebuffed. Just so we're clear, at this point we have no intention to mass test our staff, Assistant Warden Joseph Romick replied. On May 29th, SDPHS revised guidelines to test all asymptomatic staff and inmates were ignored. On July 2nd, its offers to provide PPE were rejected. It took until September 21st for the facility to discuss its COVID containment plan. It took until September 23rd for the facility to collaborate with SDPHS on testing. Throughout those months, as Romick sent regular updates racking up the case numbers, +1 staff, he'd write, SDPHS was forced to circle back to resolve errors, inconsistencies, and unreported cases. And all the while, Otay Mesa was releasing potentially infected detainees into San Diego. No list of street releases was provided to SDPHS until September 23rd. ICE could not be reached for comment on any of the allegations in this article. Really? Decisions like this at Otay Mesa and other facilities do not only put the health of staff and detainees like Sierra and Mejia in danger. Experts say that since detained individuals and staff exposed to the virus act as disease vectors outside the facility, outbreaks in detention centers can be catastrophic for neighboring communities by rapidly overwhelming ICU capacity. California State Senator Scott Wiener has labeled ICE a known superspreader of COVID-19. On July 17th, Sierra was released. While she's left Otay Mesa, it hasn't left her. She continues to have flashbacks, nightmares, and insomnia, and she hasn't left the immigration system either. She's in asylum proceedings, and her court date got pushed back from November 4th to April 24th of this year. Her son is afraid whenever I leave the house that I won't come back, she said. If I had to go back, I don't think I'd make it out. As a new administration has entered the White House pledging to battle for the soul of America, taking care of people like Sierra is not merely a moral obligation. Ensuring the transparency and accountability of the immigration system that defines this country in a way that protects the health and humanity of immigrants is essential for the battle for American lives too. Yeah, that's wow, heartbreaking, infuriating. Uh, there's so many words that would go with that. I'm. It's hard to read things like that, and the hardest part is to know that it's true, and that there's much more and much worse than that. That's just what you happen to hear about. There's so many more stories that you don't hear about, or like you don't hear about. I hear about a lot of them. Um, and a lot of us who work on this issue hear about them and or see them firsthand, but we can't always tell the stories we hear. And a lot of times the people in these situations are unwilling to share those stories because they're afraid. Sierra was a very brave woman to come out and, say these things, because if she ends up back in ICE custody, somebody who read that might be like, oh, you thought you had it rough last time. Well, let's get ready and buckle up for this time. I mean, there are a lot of, as I've said in other shows, there are a lot of really awful people working in the immigration system. And, even though we have a new president and a new attitude about immigration, you can't just turn a page and suddenly start over fresh. There's a lot of holdovers. There's a lot of ways that people have been doing things for a long time that are going to continue. And it's not going to get better right away. It's going to take some time. And it's going to be tough to make these changes, because there's a lot of people who, like I was talking about earlier, derive power from making other people frightened about immigrants. It's just an old trick. Let's get you frightened about those people over there so you don't notice what we're doing over here. And that's going to be even harder to change, because not everybody knows immigrants, has contact with them on any regular basis, has an opportunity to learn better. And I think that's the way you get to understand people, is to get to know them. And if you want to know what immigrants are like, get to know some immigrants, hang out with them, spend time, work with them, do things with them, and you'll start to see, one, that they're just people. You're a people, they're a people, we're all people, and it's not that different. And then you'll start finding some really wonderful people that you just adore, and you're very glad that they're here. And then you might start asking yourself, hey, why was I against this so strenuously for so long? And it's a good question. It's a very good question. Anyway, I appreciate you joining us. We're going to have to let you go, but this has been CU Immigration here on WRFU LP Urbana 104.5 FM and UPTV. And we'll hopefully see you soon.